Bismillahirrahmanirrahim. My name is Professor Hussain Bashkolachi. Today, this is the 6th May 2021. I am in Hyderabad, Pakistan. Uh, Through this video, I shall try to inform you about the COVID mutation and the latest situation in the Pakistan. I have a local newspaper, Kavish, in my hand. You can see that, and it says that the positivity rate in Pakistan is 9.17 and total 37,500 and 87 tests were conducted and 4,113 means 4,000 plus cases were. But the good thing is that the number of active cases in Pakistan is reducing, and that is presently 84,480. It was more than 100,000 in few days ago. So this is the position in Pakistan, and Karachi and Hyderabad in my province of Sindh. The cases are reported on daily basis, but the death rate in Sindh is still lower than the other provinces. Punjab, KPK, and Balochistan, they are showing a higher positivity rate as compared to this province. So more I shall talk about the mutation, and you can see that I have a note in my hand, and the camera is showing you that these are the important mutations uh, of the coronaviruses, and WHO technical lead Dr. Kirchhoff, lead technical lead, has mentioned 10 variant of concern or variant of interest uh, about the mutation, and the mutation of the UK is called B1.1.7, and the South African B1351, and Brazil is B1. The double mutation, which is nowadays reported from India, where the pandemic force is very high, is B1.617, and another triple mutation B.1.618 is reported from the West Bengal. So these are the mutations you can see, and we are concerned with the double mutation of the India and triple mutation, as well as the UK mutation, which is reported in Pakistan, as well as the South African Brazil mutation, but the UK mutation is still predominant in Pakistan. So these mutations do occur where the cases and infectivity rate or the number of people increase. uh, so in Pakistan, the Punjab province, there is unconfirmed report that a new mutation might be there, and that may be called the a new mutation, and the name can be given to that because Punjab is affected more, and even the Lahore hospitals and some of the patients from Gujranwala and others because of the shortage of the beds. But luckily in Pakistan, still the vaccine supply is better. Yesterday, I got a Facebook message that even the power plant and steel mill Karachi may revitalize and start making oxygen from the water through the water electrolysis process. So I think even my hospital, Isra University Hospital, where I am working, there is a plant attached to our water filter plant, and a vaccine is oxygen is generated. Luckily, I think the 11 centers in Hyderabad are working, and at the Talka level in Sindh, I think all the health facilities they are also uh, giving vaccination, COVID vaccination approved by the government of Pakistan and under the guideline of NOCOC and government of Sindh. That is, I think, a very big work, and everybody should help. In Isra University, we have our vaccination center started on 30th September with the cooperation of Government of Sindh and District Health Officer and Director General and Secretary Health uh, Dr. Qasim Jatoi especially gave permission to start vaccination and provided the vaccine Sinopharm to our center. And every day, over 100 people they are getting vaccine in our center, and we may start night shift also. Uh, so with this, I think the SOP importance is still there, and government of Pakistan NCOC regularly is watching. From 8th May to 16th May, the intercity transport will also be halted or will not be allowed to move on the roads. The SOPs, even in my locality, I have seen the rangers, army, police, they are active. But still, we need community support, community awareness, cooperation, because without hand washing, social distancing, use of mask, even after vaccine, these SOPs should be followed till the pandemic is controlled all over the world. As our neighboring country India is crippling, and one of the picture I have seen where even the Gurdwara people they are arranging the vaccine outside it so that the visitors and those who are visiting these religious places they can be helped out, because the hospital beds and oxygen supply both are in shortage. Even the doctors they are in short supply, and India is 1.3 billion people country, and Pakistan is also a very populous country, sixth largest country. So SOPs are important. I appreciate the government of Sindh efforts in vaccination, as well as the chief minister is briefing every day about the latest situation. I think this is the active chief minister in Pakistan, Syed Murad Ali Shah, and the government of Pakistan People's Party. I think together the people, government, army, rangers in Pakistan are working well in a coordination. The doctors, frontline workers, they are also fighting with their full wisdom as well as courage to deal with this deadly virus. So I appreciate the efforts of the healthcare workers, doctors, nurses, anybody who is supporting in this pandemic deserves appreciation. The media is also taking this issue. With this, I will request to my students and health workers working in Isra University and other, because government has allowed to register them for the vaccination till 30th May, which was previously closed and open for a week. So they should go to the NIMS website and register as per the guidelines given, so that they can get the vaccine on a priority basis. Students, healthcare workers, particularly medical students of the Isra University, frontline workers, administrators, professors, doctors, PG students are requested to spread this message, and they should register on the website given by government of Pakistan, National Immunization Management System. We call it NIMS or NCOC. 1166 is the number given on which they can send their national identity card. Uh, with these efforts, I think we can defeat the COVID vaccine, and these videos are made for the public interest, and please subscribe it. And if you have any comments, queries, we are ready to reply. I appreciate the efforts of Vice Chancellor Professor Nazir Ashraf Laghari in Isra University and the Government of Sindh for establishing the uh, vaccination center, which is free and open for all. Only you have to register yourself with 1166, which is a national number. You can send your identity card CNCI, and you will get a reply. 40 years and above are in a priority, and 50 and 60 years they are getting the message very quickly. So please don't delay. And for the public and for your own safety and for the safety of country, the vaccination is important, SOPs are important, and your cooperation and your confidence in the science is also important. Pakistan Zindabad.